All right, so I want to talk a little bit about the work that we've been doing with Farm Bureau. So our objective with the opiate crisis in Farm Bureau is to really reduce stigma that's associated with opiate addiction. We want to provide resources and teach others how to safely dispose of unused prescriptions. And oftentimes we talk about resiliency and reducing the stigma. That's very, very common to mental health. So I think it is awesome that I'm following the presentation that we just had, because I think several of the things that I will talk about are very, very similar. So some of the things that we've done with the Minnesota Farm Bureau is that we've partnered with an organization called Rally, and that's the RX Abuse Leadership Initiative. And we've received funding to help us promote the farmtownstrong.org website. And also to say, we teach others to safely dispose of unused prescriptions. And the farmtownstrong.org website is unique because it was a website that was developed by the American Farm Bureau and the National Farmers Union to really take a look at the data that was done by Morning Consult, a national survey across the United States that indicated that farm and ranch country were being impacted by the opiate crisis. With that, once we saw that data and really took a look at it, we really felt that it was our job to bring awareness and the resources to rural Minnesota to help combat this issue. We also feel that we need to be at the table. And when I talk about being at the table, I have had several opportunities to go out and talk about the opiate epidemic at different events. One was the Association of Minnesota Counties at their opiate summit. And there was a room about 350 people to 400 people in that room. And when I asked how many were farms or associated with farming and ranching in Minnesota, only 7 people raised their hand. And that told me that farmers and people that represent farm organizations are not involved in an issue that's actually impacting our rural communities at greater levels than our urban populations. We also want people to understand farm culture. And when we talk to different groups, that's just generally described as solitary, proud, independent, and self-sufficient. So why? The opiate crisis has struck farm and ranch families much harder than the rest of rural America. I talked a little bit about that in regards to how it's impacting versus our urban populations. We believe it's our duty to keep our farm families and rural communities safe and healthy. And within Farm Bureau, we talk a lot about farm safety and health and farmer wellness. And in my 24 years with the Minnesota Farm Bureau, in the last 4 to 5 years, did I ever think that I'd be talking to my farm families about mental health and opiate addiction? It's traditional farm safety. It's tractor rollovers, it's PTO safety. So to bringing in a completely different topic that oftentimes is closed doors behind farm families, it's conversations that are within, have been unique and different, but also very much accepted. People want to learn more about these topics. Farm towns will overcome this epidemic through strong farmer to farmer support and the resilience of communities. And we talk about that, about breaking down the stigma and just having those conversations with each other. Some of the 2 statistics that came out through the Morning Consult were very alarming. 74% of farmers and farm families say they've been directly impacted by the opiate epidemic. 3 out of 4 farmers say it's easy to access large amounts of prescription of opiates without a prescription. Understand that 80 out of 100 prescriptions are written for opiates. And I also want to address men versus women. In 2016, over 41,000 men had an opiate addiction, and that is twice the level of women. So knowing this and thinking about this, and I'm going to pose the question, if you look in your own medicine cabinets at home, how many unused opiates do you have? Oftentimes farms and farmers and ranchers are savers. They can't get away from the farm. They forget to dispose of their unused medicines. They're no longer taking them. And sometimes what we hear is that there's a tendency to self-medicate or to actually pass an opiate on to someone else. It only takes 3 days to become addicted to an opiate. So say you have somebody who lives on your farm that you may have passed off an oxycodone to, and then maybe the next day and the next day because you don't have time to get away because the harvest needs to come in or the cows need to be milked. And just that quickly, if you're susceptible to an addiction, that you can be addicted to an opiate. So how are we approaching? But more importantly, how can you help? We are encouraging people to set up outreach meetings and participate in events to build awareness. Again, let's talk about reducing the stigma. 4 out of 5 farmers say that if we can reduce the stigma, we can have an impact on the opiate epidemic. Making sure that agriculture is sitting at the table, and I already addressed that. I've had meetings all across Minnesota on opiates, and it very specifically trying to invite people that are involved in agriculture, from veterinarians to local medical personnel, firefighters, law enforcement, county commissioners, anybody that I, as somebody that's associated with farming and ranching, can have that conversation with. I've identified opportunities to share information that might be going into a local health fair. It might be going to the Department of Health in our own counties, going to the state. Also engage in partnerships. Find those partnerships that work for you. It might be with your local sheriff's department, assisting at a National Take Back Day. It might be working at your local pharmacy just with some material to hand out to people about the safe disposal of unused prescription meds. And then probably one of the things that I think is the most important is talk to farm and ranch families every single chance you get, whether it be pass a card. And if you need any of these resources, seek me out, I can provide them. We can create conversations that there's avenues to help. We can educate others on the safe and affordable ways to dispose of opiates and why that's important. I already talked about those unused prescriptions. I'm going to use myself as an example. When I started to talk about this, I thought I really need to lead by an example. So I went into my own medicine cabinet, and not only my medicine cabinet, my kitchen windowsill, my bathroom medicine cabinet, my end table next to my bedside. I found fentanyl patches, oxycodone, 2 bottles of liquid morphine from my daughter's surgery that I had all left at home. And I'm disappointed in the fact that I didn't take a picture when I was done disposing of those unused opiates. And I don't think that I'm unusual or different than a lot of people. These were just there, sitting there because I really didn't know what to do. And once I became educated on how to take back or get rid of unused opiates, I made the point to do so. We've handed out, and I'm going to try to hold this up so everybody can see it. It's a disposable kit to deactivate drugs. This is environmentally safe. It's charcoal based, and it actually deactivates an opiate. So sometimes if you put it in coffee grounds, you can throw it away, but still know that the components that can make you feel good are still there. And yes, an addict will do what they need to get that medicine out of that whether they're sucking on the coffee grounds. We have heard of this. In fact, we've even heard of people actually drinking their own urine to get that high out of the residue that's left in urine. So this is a Minnesota company. We've given it about 15,000 of these through Farm Bureau. And if anybody would like some to hand out or like on their own, please email me and I'd be happy to provide those. If you equivalent the 15,000 of these that we handed out through Minnesota Farm Bureau, that takes about 500,000 opiate or unused, I shouldn't say just say opiates, but unused prescriptions out of medicine cabinets. And that's important. There are other ways. This is, I think, probably the easiest because what I've heard is that farm and ranch families like to do things in the privacy of their home. I've had elderly women say to me, I don't want to go to the local sheriff's department to drop my unused prescriptions off. I'm scared I'll be targeted or I'll get seen as maybe somebody who has an addiction. Again, it's a very private issue. So this is something that you can use in the privacy of your home. Other ways you can dispose of if you don't want to use the deterra kit, oftentimes there's drop boxes at local pharmacies. You can participate in National Take Back Day, which are generally in April and October. I am on a mission with the DEA to add another date to that because quite honestly, if opiates and the addictions are impacting rural America at the highest levels, April and October are not good days to collect unused prescriptions. That's busy time for farm and ranch families. So I've had several conversations about adding an additional day in July. Provide opportunities for others to share their stories and learn from each other. I and I have an aha little logo on here, because when I've gone out to grocery stores in our local rural communities, or I've gone out, I can't believe, because I'm there representing an issue that's in our rural communities, they open up to me and they start to talk to me, and they'll share with me why my wife is addicted to opiates, or I have a son, or I just went through this, or I have somebody that is impacted. And we go back and we talk about that 3 out of 4 farmers say that they've been directly impacted. They are willing to share their story, but they're going to not just open up and share their story to anyone. So once we start having that conversation, they're willing to open up, and again, we can reduce that stigma. Provide opportunities to learn from the experts. If you've been involved with Farm Bureau programming over the last 2 or 3 years, we've had speakers from the Minnesota Poison Control. We've had people from the prescribing work group in the state of Minnesota, the Department of Health. So just, I think whenever we can learn more about the topic, that's really, really important. And then continue to create conversations with decision makers, have with your local legislators, and talk about the work that they're doing on the opiate crisis and why it's very, very important. My contact information is here. I think there's probably going to be some questions, but I've also listed 4 websites on here that are very, very useful. Farmtownstrong.org is the website I initially talked about the information that the Morning Consult did and why we're doing the work that we're doing. Rally Minnesota has been our funding mechanism, but they're also helping us coordinate those outreach meetings across the state of Minnesota. Change the Outcome is general good information. It can direct you to roads to recovery. And SAMHSA is also kind of the big one, the government one. There's a new one that was just released and announced in the last couple months. And it's called the Opioid Community Toolbox. And that's the federal government former Undersecretary Ann Hazlitt worked on that. She is working with the National Drug Policy. So any questions?
Well, first, this was a fantastic presentation, Ruth, and I think speak from UMass, but I think many others that this is such an important area, and a big thank you for being here representing this topic today, and to thank Minnesota Farm Bureau for being a safety and health champion from all aspects. I mean, this really gets to some of the more holistic parts of health, and that this is an important issue too. So thank you for being that champion, and also for being a partner to this event. We're really excited to have you.
Thank you.
Oh, go ahead.
I want to mention one thing is that there is the virtual, it's a bedroom that looks like a teenager's bedroom, but it has all the indicators that your son or daughter might be dealing with an addiction. So it's a virtual experience that you connect on. I think there's a link on the UMass website on that. So so it's pretty awesome. I learned some things.
It was great to have that at FormFest last year, but it's also they did such a nice job making it a virtual experience as well. And you can kind of walk through it, even though it's online now. So there's a link for that in the chat right now. If anybody's interested, it's also in several spots on our website, including in the Minnesota Farm Bureau exhibitor booth. So I would encourage folks to check out their booth and explore some of the resources and areas that Minnesota Farm Bureau is working in currently. If there are any quick questions, we can definitely address them. But one of the questions I had, Ruth, is you showed those packets, and I think that those are, such a great resource for the reasons that you mentioned, that it can be something that there's stigma or that people are really private about. So I just wanted to hear one more time, where people can either access those, whether it's from Minnesota Farm Bureau, can you buy them? Maybe talk a little bit about that.
So my website is there, and if anybody would like a free one, I am more than happy to mail them out. You can get them, I think Amazon actually sells them. They're about $6 a piece, and it's Deterra, in the prescription drug deactivation systems is what they call it. And I want to reiterate the fact that you can actually pour up to 30 tablets. I actually have even like the size they use in hospitals, but this size is kind of an at-home one. It does patches, liquid, or tablets. You can just put it in. I will advise people, don't seal it too soon, because it bubbles and it foams, and you could have a small explosion. Trust me, I know. And then seal it, and you can actually drop this right into your garbage. It is, you know, it's completely biodegradable, except for right now the little tiny patch, but doTERRA, the little strip that seals it. I know doTERRA is working on that. So you can also go to the doTERRA or Verde, VERDE company, and find that material too. So I can put some of that into the chat. Directly how to go to the Verde is the company in Minnesota that makes it.
That sounds great. That's a great resource to have. And I think this actually blended in well with the previous conversation we had about farm youth. And, you know, these are issues for families and communities. And, you know, we're really glad to have you, Minnesota Farm Bureau, working to support farming communities. So thank you for being here today, Ruth. And thanks to Farm Bureau for being such a champion and partner and sponsoring the UMass Expo. If anybody has additional questions, wants more, as I said, check out their exhibit booth and consider connecting one-on-one with Ruth. Thanks for being here.
Thank you.